We offer STI and HIV testing at SHS. If you have family packed, the fees will be waived. If you don't, the fees are very minimal. It's important to get tested before and after every partner because the most common symptom is no symptom. It's also important to have open communication about your testing history and ask them questions about when the last time they got tested was, what the results were, and if they were positive, whether they got retested and treatment. So first, let's talk about viral infections. So the first one is HPV, or human papillomavirus. It's spread through skin-to-skin contact and oral, vaginal, and anal sex. It may cause genital warts and these cell changes in the mucous membrane and possibly cancer. You get tested through a cervical swab, but right now there are only tests available for people with cervixes. There is a vaccine available, so you can make an appointment at SHS for the Gardasil shot, protects against the 9 most common strains, but there is no cure. Next, we have herpes. It's spread through oral, vaginal, and anal sex. It can cause temporary sores or blisters in the mouth or genitals. So type 1 is going to be oral herpes. That's more commonly associated with cold sores. And type 2 is going to be genital herpes, but you can transmit oral herpes to the genitals and genital herpes to your mouth. So you test it through a blood test and a swab of the sore. And there is no cure, but there are treatment options available. Next, we have the human immunodeficiency virus, or HIV. It's spread through blood, semen, pre-ejaculate, vaginal fluid, or breast milk. It attacks the immune system and can eventually lead to AIDS. And it's also tested through a blood test and oral swab. There is no cure for HIV, but there are treatment options available. Next, we have the bacterial infections. So I'm going to talk about chlamydia, gonorrhea, and syphilis together. So they're all spread through oral, vaginal, or anal sex. Syphilis can also be spread during pregnancy. They can cause infertility and PID, both chlamydia and gonorrhea. For syphilis, there are different symptoms during each phase, and if left untreated, it can lead to death. So chlamydia and gonorrhea are tested through a urine test and a swab test, and syphilis is tested through a blood test, and all 3 can be cured with antibiotics. So with viral infections, there is no cure, but there are treatment options available, and bacterial infections can all be cured with antibiotics.